Welcome. I'm Leslie Canham.
I'm Mary Gavoni.
I'm Linda Harvey.
I'm Olivia Wan, and together we are the Compliance Divas.
Welcome to the Compliance Divas podcast. This is Linda Harvey. I will be your moderator for this episode. As the Compliance Divas, we bring clarity and simplicity to compliance. And in doing so, today we're going to talk about something that you normally don't think about on a top of mind in the dental practice, and that is TB or tuberculosis. But yet it's something that's very important to be aware of what's happening in our community and across the country. And actually, every time we use a disinfectant surface wipe, spray, or wipes, we should be thinking about TB because we're required to use surface disinfection products that actually kill TB. So it's in our practice, but we don't think about it on an active, when we'll play on that word, Mary, active state when it comes to TB. So Mary, we've got today, the Divas have 5 tips or 5 things we think every dental professional should know about TB. Can you jumpstart us on number 1, please?
Absolutely, Linda. The first is that the transmission risk of tuberculosis in a dental practice right now is low, and that has to do with the fact that even though there are cases, there are not a lot of cases, except in some certain areas, which we'll talk about. But it's very possible that your patients or a prospective patient that may come to your practice has already been advised by a medical professional not to have any dental work done because of the aerosol and the potential risk of spreading tuberculosis. But if somebody is undiagnosed and we don't screen for symptoms of tuberculosis, then there could be a risk to dental professionals because of our aerosol generating procedures. And remember that both the CDC and OSHA say that aerosol generating procedures are the use of a high-speed handpiece, an air water syringe, an ultrasonic scaler, an air polisher, and an air abrasion device. So any of those things can cause a risk of transmission. TB transmission, TB infection happens through exposure to an individual who has an active infectious TB case and is around 30 minutes or longer, which kind of fits that category for dental procedures. But we just need to make sure that we are understanding the difference, and we'll talk about this too, between someone who tests positive for TB and means they've either been exposed or they have latent TB, and someone who has active TB.
So thank you, Mary. Those are some great information for our listeners to bear in mind about TB. Our diva, Leslie, couldn't be here today, but she wanted us to talk about 2 things in particular, and that is the TB protocols that are required and what's the difference between active and latent TB? Because Mary, just as you talked about, is the patient infective or not? It's important to know. So let's first talk about the written TB protocols. Both the CDC and even the ADA recommend that dental practices include a TB-specific infection. And as we know, many states have adopted the CDC guidelines into law in their State Dental Practice Act. So it's not something that's nice to have, it's something that you must have. Your written protocol or your plans, this should include screening of new hires, referral procedures if a patient has the signs and symptoms of TB, and team training in general. Now, clinically, when it comes to the difference between active and latent TB, we want to bear in mind that with latent TB, the bacteria is present, but it's not active. And there's no symptoms, and that patient is not contagious. And the only way that's detected is through either a positive TB skin test, blood test, and sometimes a chest x-ray, but they could be normal as well. But only about 5 to 10% of people with latent TB actually develop active TB if untreated. Whereas active TB is somebody they have the bacteria that's active and it's multiplying, and they have a persistent cough for 3 weeks or longer. They have chest pain from all the coughing. And then maybe they're coughing up blood or sputum. So this is highly contagious because of the airborne droplets that Mary discussed with our aerosol generating procedures. So this type of patient needs immediate treatment. So it's important that when we go through our updates with medical history with patients, is to make sure we include those questions and not just simply ask the patient, has there been any changes in your medical history? But that's a whole nother topic on medical history, isn't it, Mary? So, Mary, can you, Diva Olivia was not able to join us today. So, would you mind talking about the next two items on our top 5 tips, please?
Absolutely, Linda. And you alluded to the TB protocol for a practice, and that does include healthcare worker screening. The CDC, in its updated guidance, and we will put a copy of that in the show notes, has recommended that all new hires be screened for TB before they start working in a healthcare facility. And if they're found to have active TB, they cannot be working in that facility. Even if they're working in the business office, they are not allowed to work in a healthcare facility. So somewhere between the time you agree to hire a new employee and they actually physically start working in the office, you need to send them either to an urgent care facility or to the county health department to have a tuberculin skin test. And the results of that could take up to 48 hours. So if that person, again, tests positive, there needs to be some more investigation as to why they test positive. Were they simply exposed to tuberculosis earlier in their life and they will always test positive, or do they have an active infection? And if they have an active infection, again, you cannot have them work in the office. So I'm going to put my HR hat on for just a second and talk about what this means. So with this requirement to screen for tuberculosis, you don't want to enter into an employment agreement with someone. You enter into a contingent offer of employment based on the results of their TB test. Because if you have an employment agreement with someone, yes, we're going to start right away, and then you find out that they have TB and can't work, you may be obligated to pay for some unemployment benefits while they are unable to work. So we give a contingent offer of employment first based on results of the TB screening test. Now, I hear from practices all the time that haven't been doing this, and they say, well, what about the rest of the team? We have never done any TB screening tests, so what should we do? It wouldn't be a bad idea to either have somebody come to your practice or you send the employees to the health department just as a one-time thing. Then you've got some documentation that you don't have anyone with active TB, just as a risk management tool. But there are no states that I'm aware of that require an annual TB test unless there happens to be TB testing in their particular area. But some of our listeners may be working in hospital settings. If you are an oral surgery assistant, maybe a pediatric assistant, and you do hospital cases, then you have to follow the hospital policy, which typically is an annual TB test. So we need to have that protocol. And in addition to that protocol, we need to make sure that we have appropriate PPE. If you remember back during the pandemic, we were told that we could provide emergency services for patients when our practices were shut down, only emergency services. So the same kind of protocol that you would want to protect from COVID-19 transmission applies to tuberculosis transmission. If you have a patient who is in pain, they have a toothache, they have an urgent problem, then you should be prepared with N95 respirators to wear that's going to give you the best protection against TB transmission for you. You absolutely need to use high volume evacuation if you're going to create some aerosol. And you may want to think about scheduling that patient at the end of the day so that there aren't other patients in the reception area and you minimize the amount of people that may be exposed. If they truly have an active case of TB, they would have been advised by their physician or the health department that they need to be wearing a face mask, and it's possible they may even be wearing a respirator. So we want to protect everyone that we can. Now, the good news is that there are shorter treatment times now as drugs to treat tuberculosis are getting better and better and better. Typically, it has been about a 6-month treatment on either one antibiotic or a combination. Typically, when patients are treated, they start them out on 3 or 4 medications. And by process of elimination, they determine which one is going to work the best, and they keep that patient on that drug for about 6 months until they're no longer infectious. That time has been cut by a couple of months now. We're hearing and reading that there are 4-month regimens for treatment, which is great, less time on the antibiotics. And so that makes it a little better. But keep in mind that you may have patients who have no idea that they have tuberculosis. They may think they just have a long cough, and they've not seen, maybe they don't have healthcare coverage, so they've not seen a physician to be diagnosed. And so if you have someone come in to the practice that says they've had a prolonged cough, which the CDC says is 3 to 4 weeks or longer, if they've had a fever, if they've had unexplained weight loss, I'm waiting for that one. And if they have night sweats, a lot of women will report that they have that. But if they have a combination of those symptoms and they're coughing up blood should be alarm bell that for all of us, that we don't treat this patient until we know why are you coughing up blood, because it could be something far more serious. So we screen, we send them for a medical evaluation before we treat, unless it's an emergency. And so we need to make sure that we're doing really, really good screening on patients with potential symptoms of tuberculosis.
Mary, that was phenomenal. So let's take a moment and unpack some of the information, because you had a lot of nuggets in that information. So first, to revisit your tip on HR, and I think that's a great awareness for all of our staff and team members that are listening to us. And I would liken it to the drug screen. So that way it's easy to remember. If your practice does drug screening, it's a similar thing. You offer contingent employment based on the results of the drug screen. So contingent employment based on the results of the TB test. That's beautiful. And I like the fact that now we are learning that there are the regimen has been reduced even by 2 months. But let's also refer our listeners to go back to about 2 weeks ago, perhaps, maybe it's last week, and listen to the podcast on antibiotic stewardship, because I think that really dovetails in what you talked about. And listening to Dr. Marie Fluent, who's just phenomenal in the world of infection control, talk about what that means and what it involves. Because if a patient comes in, or you're screening a patient and you've got potential symptoms, I think it's really helpful for the team members to understand that. And it's also helpful for us to understand it individually in case we ever contract TB or somebody we know or love. So just having that information is very powerful indeed. So Mary, before we offer any other tips, I'd like to go back and first, I'm going to revisit the 5 things that everybody needs to know about TB and restate them. So transmission risk is low in dentistry, but it's not zero. Written TB protocols are required. Understanding what clinically, what latent versus active TB matters and means. And then updated screening for healthcare workers, definitely need to do that in your practice. And then the fact that number 5, there's shorter, safer treatment regimens that are available now. So I encourage you to go back and look in your OSHA binder for your TB policies. Make sure it's up to date. And if you don't have one, now is the time to develop one. So Mary, before we wrap up, do you have any other tips or suggestions you'd like to share?
I do, and we will put these links in the show notes. Number 1 is to track the CDC's TB statistics pages, because in the past couple of years, there have been a significant number of cases of TB in the U.S. Kansas City, near where I live, had almost 80 cases, 79 cases, I believe, of active TB. And we've had some outbreaks in the past in California and Florida and a number of other states. So you need to know. Also check your county or state health department website to see if there are active cases of TB in your area. And also, if you live in a university or college town, because colleges and universities have a lot of international students. And those international students, depending on where they're coming from, especially if they're coming from the Asian continent, where TB infection rates are very high, they may have been exposed. And if they have been exposed to TB, they do have the potential over their lifetime to develop a TB infection. And the things that trigger it tend to be things like stress and what the amount of stress, going to college in a foreign country where you maybe don't speak the language fluently, so that's a little stressful, could trigger that. We actually had a case when I lived in Michigan in the high school in my area where a young man who emigrated to the US from India, part of that Asian continent, and he developed a TB infection while he was in the US, and he hid his symptoms because he was afraid that he would be sent back home and he didn't want to go. And unfortunately, this young man died at 17 years old, died from tuberculosis, which may have been treatable, but he was so worried that he would be deported because of his TB infection that by the time he revealed his symptoms, it was too late to treat him. So that's sort of a tragic thing. So keep your finger on the pulse of the statistics to know whether your area is at high risk. Be prepared by having some N95 respirators on hand in case you need to treat a patient that has an emergency, and make sure you follow up on screenings for employees. Unless your state changes this, it's a one-time only.
That's perfect, Mary. Thank you so much. And I was thinking about the transmission rates as well. Oftentimes, when I'm on site with a practice, I will go ahead and check what's going on in their county and maybe even note it on the footer of their policy, what year it was checked, what the rate was. So even though the policy itself is current, we're showing that we're checking the TB transmission rate on a regular basis. So I like to just add in a little bit of information. But those are some great reminders. We will make sure that those top 5 reminders and tips are in the show notes, as well as some of the links to the CDC that we spoke about. So thank you for joining the Compliance Divas today. We bring clarity and simplicity to compliance and helping you to navigate that regulatory world. So please don't forget to check out all the rich information in the show notes. And while you're there, scroll down and leave us a like or a message. We'll see you next time.